Dear friends and colleagues, today I'm going to share with you insertion of two implants using implant positioning kit to replace the guided implant placement technique. We can see here the x-rays and the bone. We don't have enough bone, just enough for implant placement for premolar and molar region. After incision and reflection as usual, maintaining the integrity of the periosteum. It is very important for the healing of the bone after the osteotomy and implant placement. We select the suitable diameters and adjust the parallelity and the position of the two implants. Then we start with the osteotomy as usual with the pilot drills to the length of the implant. We selected here to insert 3.75 millimeter implant and 4.1 millimeter implant. Following the pilot drill and the initial drill, we increase the osteotomy to the corresponding size of the drills to the implant diameter planned. This is the final drill for the 4.1 millimeter implant, and then we go for the implant placement. We can use the engine driven implant placement or the manual according to the preference of the dentist. After that, we remove the implant mount and put the cover screw. We can see here the parallelity of the implants with good inter-implant distance and enough distance between the implants and the adjacent teeth. Then we start suturing as usual after insertion of the cover screws. It is a very simple case. I hope you like it, and please do not hesitate to contact me if you have any question through my email or upon the YouTube page. We have here the healing, and this is the pre-operative and the post-operative. Thank you, my friends. See you soon.